Idaho voters moved to expand Medicaid, but the specifics haven't been ironed out yet. And as 6 on Your Side's McKenna King reports, the process continued tonight with mixed results.
Dawn, dozens of Idahoans met at the Department of Health and Welfare this afternoon to testify on a first-of-its-kind waiver that would offer Idahoans eligible for Medicaid expansion to either choose Medicaid or be given a tax credit to purchase a health plan through the Idaho Insurance Exchange. The public testimony was largely against the waiver over fears the Department of Insurance is trying to steer people away from Medicaid, while the Department of Insurance says they're just trying to give people a choice.
This is veiled as a choice. It really creates kind of a false choice because Medicaid expansion is much cheaper to the individual.
This Medicaid expansion related waiver, the first of its kind in the United States, is proposed to give Idahoans who are between 100 and 138% of poverty level two options for government subsidized health care. Option 1, using a government tax credit, Idahoans at that poverty level would be given the option to select a health care plan using Idaho's healthcare exchange.
The worry is that people who earn between 100 and 138% of the poverty level would not be able to afford these plans. And then if they couldn't afford the premium or the copay or the deductible, would they be kicked off these plans?
Or option 2, Medicaid.
The waiver is unclear as to whether they would be given both plans side by side so that they could compare the options.
Which is why the Idaho Department of Insurance says they're accepting public comment.
There may be, for whatever reason, people that just don't want to go down the Medicaid route, prefer to pay their premium on their own, or there may be certain doctors that they may not be able to access under one path or the other.
And if the waiver is approved, those people are still eligible for Medicaid.
It's just giving that choice that they'll decline the tax credit and then be able to enroll in Medicaid.
But whether the two choices will be presented side by side to the individual.
At this point, that's kind of an operational decision that I hope that is the way it works out. The waiver process, the waiver application really is intended just to let CMS know that we want to give that choice.
The Idaho Department of Insurance is still taking public comment online or by mail, and you can find more on our website, 6onyourside.com. Medicaid expansion is set to take effect on January 1st of 2020. Live in studio, McKenna King, 6 on Your Side.